Many people kind of ask me, since I'm a nurse, whether the healthcare services here are good. I have met Martha, and I like her very much. She is somebody that knows people that our age and treats them. And she's the nurse practitioner that works in this area for us. She's here for us, which is really wonderful. And she's very close. She's on the campus, and I've referred many patients, people that are neighbors, to her because they want to stay in the village. They don't want to make a trip out. So it's very helpful.
So as healthy people, we have to be sort of second voices or echo what we hear. But there's no question about it that the convenience, the accessibility, and the care that Martha and others give there, the pharmacy, I mean, it's nearly full service for any of the residents here that require that. And one of our good friends recently has been dealing with some back issues. It's just so convenient for her to go to physical therapy there, even during COVID, because, again, the environment here is secure. You're not going outside the village. So you're, in a sense, you're insulated. And I think that's a very good thing.
Our nursing facilities are the best. And I have talked to many residents. I haven't needed to be at Majestic Oaks or not yet memory care. I'm not worried though, because I know I'm going to be taken care of. I've had residents that moved here because I said, you got to come here. You've got to come here because, they were having health problems and so forth. And even though they were okay then, the fact is you never know when it'll spring up, right? Come back. So now they are able to use, we have an Oak Park clinic. There's a pharmacy right there. And we have Martha. Everybody loves Martha. She's our nurse practitioner. I think she actually is a doctor, not telling us. She's absolutely wonderful. We love her, and she cares. She cares about us. But everyone I have talked to here that have been at MO, and right now we're in stay at home, and we have husbands or wives whose spouses are in Majestic Oaks. And I've asked them how they feel, and they said that they know they're being taken care of.
You should tell them about Martha and your experience.
Well, recently it was necessary to have a biopsy. The one that, I'm sorry, what's it called? The basal cell. I'm sorry. The basal cell biopsy, which in itself is not very serious. But they decided that it needed to be done. So I went to Martha, and Martha is the nurse practitioner, and she agreed that I needed to see somebody. So I did. I found a doctor outside who did the surgery. However, Martha has been the one that I see every single week, and sometimes a phone call where she has another suggestion, because it turned into be more of a surgery than either one of us anticipated. So she sees me weekly. I just go over there. Within 3 minutes, I'm in the office. She's on time. She is very, very good. And the thing that I really like, too, is that she takes her time, but she also has an in with the doctors here and knows who to go to and how to get us in. So there's not a long waiting period. She's been wonderful. And she's helped neighbors of ours. She's helped you at one time. And she's so responsible and so responsive and so warm.
Actually, on this, I think she did a better job than the doctor.
She did.
And it's so nice just to be able to get out into Oak Park, which is a golf cart ride normally, and see her and get in. I mean, it is no worry now that we have to always depend on somebody outside the village for these things and wait for a month or so to try to get in. You can go down and call Martha's office and get in tomorrow if you need to.
Well, I myself have been fortunate as far as health goes. So I haven't had that much experience with the people in the medical profession here. But, as I said before, one of the main reasons I did move here was for my wife. And she spends all her time in the Majestic Oaks nursing facility here. And I cannot say enough about the place. The people especially, the cleanliness, the camaraderie, just being nice. I made it a habit of getting over to see my wife at least once a day, and usually at lunchtime, just to make sure the food was as good as it's supposed to be. Believe me, it is, and she did not lose any weight when she was here. As far as being taken care of, she was bedridden here for, well over 2 years, and not one bed sore in that whole time. I think that speaks volumes for the health that you have.